My name is Sofie Baarnhielm and I'm a psychiatrist and I'm working in Stockholm. I'm also Associate Professor of Psychiatry at Karolinska Institutet. But my main part of my work has been done as a clinician and also as a head of a unit in Stockholm called the Transcultural section, where we work with issues related to migration issues, and that's include mental health care, somatic care, but also public health interventions related mainly to refugees, asylum seekers and undocumented migrants. My presentation during this conference is talking about the culture formulation interview that's been included in the American Diagnostic Handbook DSM-5. And I'm going to talk about it because I've worked quite a lot with it, in particular with clinical implementation in Stockholm, but also because I think it's a very important tool. It's a tool, it's a sort of socially accepted tool to use in clinical assessment, to have an idea about culture and context in the individualized encounter with patients. So I think that's a very important start point for understanding more of culture and context in psychiatric assessment, but also for being able to adapt the mental health care system to be more culturally sensitive. The reason for why I started to be interested in this field was that I worked as a psychiatrist in a very multicultural area in the western part of Stockholm. And in the meeting with patients, I realized I had difficulties to understand them and to help them. Not always, but quite often. And that turned my interest to understand more, in particular, about culture aspects of the clinical encounter. So that was the start point for me. And it has been related both to training activities, to clinical research, to be interested of interaction within the mental health care system. From my own perspective, where I'm working in the mental health care system in Stockholm, I think the adaptation of the mental health care system in general to a globalized, very multicultural population is very important. Because as it works today, my impression is that there are groups of people in the society who don't get the help that they need. And I think because of that, there is an important issue that we adapt the system to a globalized, multicultural population, and also that we start to work with public health intervention approaches to improve mental health care for migrants, minorities, the indigenous population in Sweden. So for me, that's sort of the new perspective. It's a quite clinical perspective that I have. Well, I could give an example about an encounter with patients, but I think I will instead give an example of an encounter with health professionals. And this is an encounter that was, let's say, 10 years ago. I went to a clinic in Stockholm, in the central part of Stockholm, and it was a clinic where they worked with young adults with mental health problems. It was a part of psychiatry, part of psychiatric care. And I was invited of a very nice psychologist, and I talked with the staff, and I asked them about patients from a certain area of Stockholm, and about their encounters with patients from that area that referred to young people. And they said there was no problem because they didn't have any patients from that area. And I was a bit confused of the answers, and we continued the discussion, and I asked them about their experiences of using interpreters. And they said to me that they didn't use interpreters, they didn't need it because all the patients could speak Swedish. And at the same time, I know that from the area that I asked them about, there was a lot of people who at that time were newly arrived refugees, a lot of young people. So this was for me a sort of typical coincidence of, or coincidence is the wrong word in English. It was really a case of where probably the the mental health care system did not reach the people who was in need of it.